counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening. My name is Patty Villa, and I am the host for this half hour. David DePino has the night off. Tonight, our guest is Dr. Casey Cohen. Dr. Cohen, how are you this evening?
How are you, Patty? Thanks for having me on the show.
Thank you for accepting our invitation. Please tell the viewers and the listeners a little bit about you and the practice that you have.
Right. Well, I am located in West Palm Beach, Florida. I specialize in removal of a lot of tumors. Fancy name would be surgical oncology, but my focus is in liver, pancreas, and bile duct. So, and I also do general surgery.
And what hospitals do you practice at?
I am currently at Good Samaritan Hospital, kind of downtown West Palm Beach area, and Palm Beach Gardens Medical Center.
And before we dive right into it, what was the force that drove you to study medicine and want to become a doctor and help others?
That's a great question. I'm one of those weird people where I think I always wanted to be a doctor. And then my grandmother was sick with breast cancer when I was in my teenage years, and she came to live with us for the summer. And she had metastatic breast cancer, so she was fairly sick. And I got to spend those last 3 months with her, and I think that's what really sort of inspired me to go on and do what I do today.
And let me ask you, you've been practicing now for how long?
Oh, my goodness. I've been around the South Florida area for about 5 years, and I finished my last fellowship around that same time. So I'd say out in practice about 5.5, 6 years. And
in those last 6 years, what case is the one do you think that sticks out in your mind?
Oh, wow. There are a lot. I'd say my days in trauma really stuck out to me, in different sorts of ways. But I don't think there's one case in particular. Of course, the patients that I have with pancreatic cancer, it truly is a journey that we take together from the time that they get diagnosed to their surgery, which is fairly extensive, and then, of course, all of the postoperative care that usually involves chemotherapy, and then the road to recovery, like once you are in remission, returning back to your normal life. So those patients are very memorable because it's definitely a lifelong journey that we take together.
And saying that, and you and I, talked about this earlier today, and I shared a very personal story with you. My father died of liver disease. He had non-alcoholic cirrhosis of the liver, and my best friend's father died of liver cancer. Are you seeing these types of cases on the rise?
We are, and kind of at an astounding rate. The Pancreatic Action Network is a charitable organization, and I know we're speaking about liver, but liver and pancreas a lot of times sort of go together because they're both of them are the least funded cancers. We don't hear a lot of big campaigns, a lot of walks for pancreatic and liver cancer, and it's projected that in the year 2020 that pancreatic will be the second leading cause of cancer death in the United States, and I think that liver will shortly follow, maybe third. The most interesting part is that liver cancer used to be linked with either alcoholic cirrhosis or hepatitis B or C, but now we're seeing that liver cancer is on the rise because of exactly what you're talking about with your family, is that because of diets that are high in fat, fat is also toxic to the liver. So we're seeing patients develop non-alcoholic fatty liver disease, and we're seeing more and more liver cancer as a result of that.
Now, let me ask you, do people see symptoms? Do they feel symptoms when they're going through pancreatic and liver cancer?
So that's the sad thing, is that there are very few warning signs in advance, and there are very few risk factors that we can really pinpoint. Hopefully going forward, we'll have a little bit more research, and we'll be able to have tumor markers and surveillance tools to use for both pancreatic and liver. But right now, usually when the symptoms present, the disease is fairly advanced.
And what can people do? Like, let's say, the other day we had Dr. Kovacs here, and he was talking about trying to educate people on perhaps that are in their 30s and 40s and have possibly never gone to get a full checkup. What can we tell the people that are out there that perhaps, are thinking they have this in the family, they have this type of cancer that runs in the family, or maybe they're, like you said, the symptoms, they're just not there, they're not feeling well, maybe they should want to go, because it could happen to anybody.
It's true. So for the liver disease, I would say that, especially if you think you have risk factors, say in your 20s and 30s, that your diet was not great, if you've had your gallbladder removed in the past, just going to a routine physical and getting a basic lab panel, which can check your liver functions, and doing a right upper quadrant ultrasound. Those two things can sort of detect early the beginnings of fatty liver. If you do have that, then we can potentially start supplements, doing diet modification, and then doing a yearly surveillance of the liver with a simple ultrasound that doesn't subject you to untoward radiation. So I would say, in terms of speaking to the liver aspect, that's what I would do. Pancreatic is a little bit trickier. I think definitely a strong family history of any type of cancer. Certain types of cancers run together in similar families. So, colorectal cancer, stomach cancer, uterine, ovarian, any type of cancer in your family. I think you should start early with any type of surveillance. Of course, getting your mammograms, doing your colonoscopies, but speaking to pancreatic in particular, really the only way to pick it up at this point is actually doing a CT scan of the abdomen, and of course potentially discussing with your physician about the family history and getting some genetic testing that says that you might have a predisposition to developing one of these types of cancers.
And, I want to share a personal story with the viewers, because a few months after my father passed away, I was diagnosed with fatty liver. Now everything is normal, everything is fine, but, it was like you said, something came on, I wasn't feeling well, I went to get some labs, and they told me that I had this, and, that I really need to pay attention, because obviously it runs in the family, and like you said, it all starts with fatty liver disease. Being on a diet, and you mentioned supplements.
Yes, supplements. So we are seeing more and more research towards fatty liver, and one of the supplements showing to prove to be effective in fatty liver is vitamin E.
Yes, and you encourage your patients to take that.
I do. At the first signs of fatty liver, I tell them that we need to do some diet modifications, no fried food, try to avoid cheeses that are yellow, creamy soups, rich salad dressings, and then to start them on vitamin E. I usually start them on 1,000 in the morning and 1,000 at night.
And, one thing that I want the viewers to know, that if they're ever diagnosed with this situation, that the liver regenerates itself.
Yes, it does. It's one of those amazing things.
Yes.
So, yeah, it's not too late.
No, it's not too late, because actually that was exactly my case. I started aggressively going to the doctor and just making sure that I changed my diet, and it regenerated itself, and now everything is normal. But obviously, like all of us, we have to watch what we eat. We have to go to the doctor, and we have to get our blood work done to make sure that we're staying healthy and staying fit.
Absolutely.
How important is exercise?
Exercise is really important, not just in terms of the health benefit of being at a healthy weight, but also the release of endorphins help with your daily activity and your energy level, and also help with sleep at night. Exercise increases the amount of good cholesterol that we have, so we have that nice balance as well, and I think just promotes a sense of general well-being.
And what is it that you tell even your coworkers at the hospital that perhaps are encountering this situation? Because as you know, when my father passed away, but we were staying at Jackson, and when we were in and out of Jackson Hospital, many of the nurses there and the doctors told us that, liver disease and pancreatic disease are two of the toughest diseases to have in the body. I mean, everything is very difficult on the body, but especially those two. What is it that you tell, and especially when it comes to liver, organ transplantation is another, that throws another dynamic into the equation when we're dealing with somebody's health.
Right. So organ transplant is definitely a life-altering thing, and we never want patients to come to that, mainly because it's extremely traumatic waiting for a donor if you don't have a family member that matches. And then just the post-operative management, all of the steroids and the immune suppression that can predispose you for other types of cancers and infections going forward. So we definitely don't want you to move towards needing a transplant. So things that we can do prior to that, like we talked about, maintaining a healthy lifestyle, maintaining a healthy weight, going to see regular checkups, and if, pertaining to the liver in particular, getting that right upper quadrant ultrasound and doing a basic liver function test at the doctor, letting the doctor know that, I'm worried about this. I've had other family members that have had this. Just knowing that, you have a family history of that is important. Speaking a little bit more towards the pancreatic component, small signs for that, if patients have been diabetic their whole life and all of a sudden notice that they are having changing requirements and their insulin or their blood sugars aren't what, they should be despite really no other changes, that could be an early sign that you're developing something going on at the pancreas. If you have a history of excessive alcohol use in the past and have had pancreatitis, that might predispose you. And the most important thing is just that family history. If you have a family member, especially a first-degree relative that's had pancreatic cancer, you may want to do, preemptive CT scans with your physician in terms of surveillance.
And what age range are you seeing in your office when you're diagnosing these types of patients?
So the liver cancer is a much younger age group. I would say, now I'm seeing it in the rise in anywhere from 30 to 60 years old. Pancreatic cancer, we're also seeing a lot of wide variability, but I would say, anything after the age of 60 is when we're really, seeing a lot of it being prevalent in the clinic.
And the hospitals, one thing that, today I was at Florida Medical Center, and one thing that we talked about is that how the Tenet hospitals all work together in synergy. Mm-hmm. Can you tell us how the hospitals up in the Palm Beach area all work in synergy?
Right. So we have a lot of common, I guess I would say the most common thread is that most of the physicians cross-cover at all the different hospitals. So that's great for continuity of care. It's even though there's separate hospitals, I would say the providers are the same going to each hospital because it is a fairly small area. We're able to share, lab work, testing, especially, if you go to one particular hospital and have a CT scan, I have the ability at my hospital to pull up that same CT scan, so you're not being subjected to excessive, radiological, exams. So that's wonderful. We all share the same, what we call PAC system or imaging site. The doctors are similar, and even a lot of the nurses work between the different hospitals. And
I'm really glad that we mentioned it and we're talking about it because a lot of people that don't understand how the healthcare system works can get lost in the system trying to get their paperwork and trying to get their information.
Exactly. So it's nice, and I would say at Good Sam in particular, they have a nurse navigator. So it's very overwhelming when you're first diagnosed with cancer, so you can't remember your appointments. I need to be, here, see my surgeon here. I need to go for radiation oncology here. I have chemo this day. So the nurse navigator really gathers all of that information and sort of escorts the patient through their different appointments and making sure that none of the elements are missing.
And you also take care of people with skin cancer?
I do. That's one of my passions is skin cancer. So, and especially here in South Florida, we have, especially intense sun rays. So, and being fair complected myself and have had, skin cancer in the past, It's one of my missions, I think, to educate people on the dangers of sun exposure and let people know that, believe it or not, the sun is just as carcinogenic as smoking.
So what can people do in order to protect themselves from the sun and from getting skin cancer?
So it's actually a little bit easier than a lot of people think. Avoiding the sun between the hours of 10 and 3 o'clock, which is the most intense.
That's the time that I like to go to the beach, Dr. Cohen.
Most people do. They like to go to the beach around that time. So that part is not easy. But if you are going to go out in the sun at that time, there's protective measures that you should take. Of course, always wear sunscreen. I personally think everybody should wear a sunscreen greater than SPF of 30, and making sure it's broad spectrum. I would reapply every hour and a half, especially if you're going to get in the water and dry off, doing sports. Sunscreens are sort of in vogue now, so they make all kinds of different sprays and lotions, and ones with self-tanners. And
yes.
So it's not like it used to be where you wear those, zinc oxide pink stripes across your nose. Skincare is actually more fashionable now, which is great.
That's true. That's true. That's very true. Now we even have the masks that we sleep with at night as well, which I never thought I would see that.
I know. It's amazing.
It's amazing.
And so we also have protective clothing that has SPF 50. If you're going to be outside, sit under an umbrella. And a lot of people forget about their eyes and their lips. Lip care is especially important, not only for preventing sunburn, but, a lot of people have, herpes simplex virus. And if you burn your lips, you're going to bring out all kinds of cold sores and lower the immunity. So that's one added, reason to make sure you protect your lips.
And let me ask you, how can people protect their hands against the sun when they're driving in the South Florida, the state of Florida?
Right.
Well, and actually in other states as well, because that's something that I think about when I have my hands on the steering wheel driving from hospital to hospital and I'm looking at the sun and the rays coming through the hand. What can we do in order to protect ourselves?
Yeah, so we're seeing a rise of what we call driver's side melanoma, which is, we see these, patients that for a living they drive either a large truck or they're driving around, and, the front windshield, usually has some type of UVA or UVB protection, but the side windows do not. So it's especially if you're driving, that left hand is going to be very exposed in the sun. So you want to make sure you wear sunscreen on your hands. You might feel a little funny wearing driving gloves. So I would say make sure, don't forget about wearing sunscreen on your hands.
Okay. And I wanted to ask you about the melanoma. Are you said you're seeing a rise with the hands, but are you seeing a rise in other parts of the body as well?
Yes, we are. And a lot of it is sort of remnant from, we just didn't know what the sun could do many, many years ago. It's not the sunburn that you get today that's going to cause your melanoma tomorrow. It's the sunscreen you got 20 years ago. The younger you are that you have a blistering sunburn, the more risk factors that you have for developing melanoma later on in life. So, if you've had even just one blistering sunburn in the past, that will increase your melanoma risk 3 to 4 times that of a normal person. Those of us, including myself, who went into a tanning bed in our teenage years, that increases your risk by almost 30-fold.
But I think, all of us have been guilty of that, because I myself have been guilty of that. I mean, you mentioned the blistering. That happened to me in February. I was out in the sun. I got a lot of blisters on my chest, and I was in pain for about 2 weeks. It was excruciating. So what can people do like myself? You just mentioned that my chances are increased. I know I try to get my yearly checkup, but what can people like me do that, and like you said, you were in the sunbeds that have been exposed to these rays?
Yeah, and it's not, melanoma, of course, is the most deadly of all the skin cancers. But, we also have to worry about basal and squamous, which are most likely what you're going to get as a result of sun damage. So those look like little scaly patches on your skin that are red and flaky, and they don't go away. They seem to progressively get worse. So if you have an area on your skin that's just not healing, no matter what kind of cream you put on it, that's definitely a warning sign. So kind of keeping an eye on your own body, just like women do self-breast exams, doing self-skin exams is also extremely important. I think we have a good idea about what looks normal to us and what doesn't. In terms of melanoma, any moles that you have on your body, you want to keep a close eye on. Are they changing color? Are their borders different? Are they becoming raised, or are they ulcerating or bleeding? They just look different than they have in the past. Then I think you need to get in to see your dermatologist very quickly with types of changes like that.
And how did you find your passion with this? You do liver, you do pancreas, you do the sun with the skincare. I mean, how did you get into that whole passionate of being healthy and being a doctor? I know you mentioned your grandmother and the breast cancer, but you have all of these interests when it comes to the human body. How did that come to be? And how do you do it all?
Believe it or not, I just sort of fell into it by accident. I wanted to be an ER doctor my whole life, and then I got to the ER, and I really wasn't what I wanted to do. But what I did find out is I did like the trauma, so I went into general surgery and trauma, and then I really loved trauma and enjoyed it, but it was a difficult lifestyle for me personally, and it was just difficult. And so I did find trauma exposes you to all parts of the body, and I really enjoyed operating on the liver and the pancreas, which sort of led me to my fellowship that I did in liver and pancreas. And then the skin cancer came from personal experience. I have had melanoma twice, and so I wish I knew 20 years ago what I know now about what I had done to my skin, and I feel very passionate about it. And I don't think we should necessarily, beat ourselves for being exposed to the sun, and letting people know that, yes, even if you got a blistering sunburn 10 or 15 times and went in the tanning bed, don't be embarrassed by that or feel guilty like we just didn't know, and that now we can do safer things for our skin and reverse a lot of that damage that was done in the past.
I want to go back to talking about the liver and the pancreas, because we have a few more minutes, and I also want to touch upon a little bit more about your personal life, because I always like for our listeners and our viewers to learn about our doctors, because they are human, even though we see you as superhuman, taking care of our community. Sure. What is the case that you've done that has impacted you the most? I know you mentioned that several of them have, and that you remember almost all of them, but there has to be one case that stands out.
Oh, wow. So I would say in the present, right now, I have a patient that is struggling with squamous cell carcinoma, which, he's an elderly gentleman, and his care was so complex, and it's sort of, like I said, it's been such a journey with him from the day he came in to have the resection of his scalp, to the reconstruction of it, and to the radiation that followed, and then dealing with the burns, and then dealing with, some of the complications from chemo. And it has been such a journey, and I think it has humbled me in many respects, and sort of taught me that, I need to know a lot more beyond just the operating part, because patients, when they come to you, I think, they're not just seeing you as, okay, you're the mechanic. You're the one who's going to cut the tumor out. They're looking to you, and they want answers more than that. So I think this particular patient and the complexity of his care, it really has, broadened my sense of, knowing the knowledge of everything going around, and, that it really is a big compilation of different specialties.
And what advice do you have to those young people that are in college, that are studying medicine, or perhaps even the residents that are walking around all our hospitals, our fellows? What advice do you have for them?
Just get through residency. Residency is definitely a force. It's funny because, residency is called residency because physicians in training used to live at the hospital. That was their residence. They were only given permission to leave the hospital on rare occasions. So for the first 1 to 2 years of life, they lived at the hospital. So, one piece of advice, for the residency is that, learn all you can. Take, even though you're being told when to eat, when to sleep, when you can use the bathroom, you still are under the protection of an attending, and gathering their knowledge and asking as many questions as possible, because, when you get out and practice, all of a sudden you realize you're in it for yourself. There's really not that attending holding your hand and over your shoulder. I mean, it's all you at that point and all your decision making. And so never feel embarrassed to ask those questions, because, when you get out and practice, those questions aren't as easily, you don't have a broad range of specialties to ask and be under the guise of a resident. So I feel like the more knowledge that you can gain in medical school and in residency, the better.
And that's very important what you just said. And that's going to lead me to this question. How can people find you? If people want to get connected with you, where can they find you? Where can they call? What is your address?
Right. So I am located almost near downtown West Palm Beach, right next to Good Samaritan Hospital in the Victor Ferris building. The address is 1411 North Flagler, and we're in Suite 4900. The phone number there is 561-802-9958. And like I said, I go to different hospitals, but you can always find me through that office.
And let me talk a little bit about your personal life, because I know we're in football season, and we were talking about football season. Tell me, what's your favorite football team?
Oh, Georgia Bulldogs. I am so hoping for a national championship. We were so close last year, and growing up in Alabama, but going to Georgia and watching the final bowl game, it just broke my heart. So Nick Saban, watch out. Here we come this year.
Okay. And what is it besides football? What else? Because Charlie Tyson told me you were a huge football fan, and that's how I learned that you love football. What else do you like to do?
So I love being outdoors. I think my most favorite thing to do right now is I have a 15-month-old who I adore coming home to. He's just starting to walk and swim, and that's my pastime right now, is getting to enjoy my little one.
And your family must be so proud of you. How do you do it all, Dr. Cohen? How do you balance it all? What advice do you have for women?
Just time management, I think, and just try to take at least maybe 30 minutes a day for yourself.
Well, thank you so much for being on the show. You gave us a lot of great information, and we also want to thank All County Health for sponsoring this program. Dr. Cohen, thank you for being with us, and all of you heard where you can find her. Good night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.